Welcome to the Anatomy of Inequity, a podcast that examines how systems, structures, and history shape health outcomes long before a patient enters the clinic. This podcast is designed for healthcare students and professionals who are willing to look beyond individual behavior and examine the conditions that produce unequal care, because outcomes aren't accidental and inequity has an anatomy.
All right. Welcome back to episode 6 of the Anatomy of Inequity. I am speaking to a very special guest. She is a mentee, and I am just so excited about her story. And I wanted to bring her on because I think that she can share with us from her wisdom that she's gained in such her short career that she's just been out practicing, but her story is just phenomenal. And so I won't take time talking about her. I'm going to introduce her, and then I'm sure you will get to learn more about her through the questions that I'll ask. So welcome to the show, Dr. Bria Jackson, the dedicated PT and dismissed doctor, all of those handles, right?
Yes.
All
Thank
right.
you so much for having me. I am so honored to be able to join you on the podcast and to be on this platform with you. So thank you so much for having me.
Absolutely, absolutely. And I really think your message is going to be important because I developed this podcast for my students. And so I think that you will bring some relevance to the table that some of us old heads cannot bring. So the first question I want to ask, I ask everyone that comes on, what systems in your childhood most shaped what you believe was possible for you?
That's a really good question. And I had to really do some reflection on this. I feel like my foundation really initially started from, I believe, my mom. I feel like my mom was always very supportive, attentive, present, and always encouraging me to continuing to like fight or join or try out for a sport. So I feel like she created that foundation for me that I probably didn't really realize until just now, of me just continuing to go for different things that I always wanted. I also feel like my involvement in sports, I feel like sports teaches us about discipline. And I think that discipline is very important in all aspects of life. I know sometimes people are not athletes, but I say that like we are all athletes at life, like we're all just trying to figure this out. So I really believe that the foundation that my mom set, just being very supportive and attentive and encouraging me to do whatever I set my mind to, and just my involvement in sports and trying different things. I felt like that taught patience, which built discipline, which turned into habits, which allowed me to just like always keep going.
I love that. I love that. Shout out to mom. All right.
Yes.
So now, looking back at being dismissed from the programs that you were in, the PT schools you were in, do you think those PT programs lacked an understanding of the unique hurdles students of color face outside of just grades?
Yes, strictly because for the most part, all of the schools that I was in lack representation. So in order to understand what students of color are going through, you have to have people of color in the program. And so if you don't have people of color in the program that can relate to you on a different level, there's always going to be hurdles. There's always going to be a lack of understanding. There's always going to be something that I say or way I dress, or there's always going to be something. So yeah, I definitely believe that there is a lack of representation, and I feel like that started with just the lack of representation within the faculty itself. Far as like grades go for itself, um, yeah, I just wish that I felt like as a student of color, I experienced like microaggression, imposter syndrome. Um, I feel like as a person of color, we also do a lot of code switching. So it's just like all of those things are things that people of color go through on a day-to-day basis, that we may not know that we do, but we do to kind of maintain a certain image of ourselves because we don't want to come off as too aggressive or too much, or it's just like it's the same story just played over and over again. And so, yeah, I definitely think that that lack of representation within faculty um, is really hard when students go into it because they have to deal with these things either on their own or they have to lean on their mentors to kind of help manage that because that's a lot on top of everything else that's going on.
Right. PT school is probably one of the hardest things that I did in my whole entire life outside of having a baby. So I do understand. I'm going to segue here. This is not scripted in terms of questions, but I just want faculty to kind of understand what you're saying when you say microaggression, because of course you are going to speak to, like you said, most faculty members are not of color, right? And so what would have been an example of something that a faculty member would have said to you? And probably it was implicit bias, right? They knew, they didn't realize maybe what they were doing.
Yes, I have a really good example. I actually have two. In my program, I feel like I always show up to class. I have like a personality where I'm always kind of like smiling, joyful, like that's just who I am. And so it was a time when I was in PT school where I got like really, really sick. And so during that time, I wasn't obviously as smiling and as joyful as I typically am. And so I particularly remember, mind you, I always come to class like for the most part pretty like presentable, far as like my hair and clothes and things of that nature. And I remember this one time I had came to class and I had a hat on. Mind you, students had always wore hats, like the little caps. And I remember coming in and having a cap on, and my teacher immediately corrected me and was like, I need you to lift your hat up so I can see your eyes. And I'm looking at her like, so you can see my eye? Like, I was just very confused because I'm like, people wear hats all the time. You have never said that to them. And I feel like my head is just like really small. So sometimes when I put hats on, it makes it seem like it's covering my eyes, but I just have a small head. And so then I was taken aback by that comment because it was just like, people have worn hats so many times in class, and now you're saying something to me. Or even just another example would be during this time when I got sick, I just didn't feel like there was any grace allotted to me during that time. My professors specifically told me when I told them that I was not feeling well, which they came back and told me that I should have told them. And I'm like, I did. Professor told me during my practical, I was telling her how I hadn't been feeling well. She was like, well, in the real world, people go to people go to work sick. And so in the real world, you still have to perform. You still have to be able to perform. This came out of her mouth to me during a practical. So I just don't think that spaces were really created. So when we say microaggression, it's just like, okay, they're coming in and they have this expectation, but the expectation is really only towards people of color that they're directing that energy to. Even though my members or people who are in my cohort have done these things a million times and have taken off for other things that was approved. And here I am actually very, very sick, which never happens because I'm very healthy. I work out, I meal prep. Never really happens. So, yeah.
Wow. And then that just ties into the falsity about Black women in pain and all of that kind of stuff.
Mhm.
So that goes into that. Wow. Interesting. I hope that faculty members are listening to those things and not being dismissive of that and thinking, oh, that's no big deal. It is.
Yeah. And
All
also
right.
during the time, I was like, I don't get sick, but like I was in the hospital like twice in 1 month. So it was just like, this is not something that I'm just saying, oh, this is a common cold. I was really, really sick during this time. And I remember when
Even
I
if it
came
was a
back.
common cold.
Yeah, but it's just like I was really sick. And so for them, even when I got dismissed and I came back, their thing was like, don't use you being sick as an excuse. And it was just like, for me, I forgot that I was even sick because they had told me so many times, like, that's just an excuse. So I have examples for days.
Gosh. All right. Well, that's a good time to move on to the next question. How did carrying the dismiss label for a while affect your confidence? And how does that experience help you relate to peers or students who are struggling right now? I know you're doing a lot of work with that right now and reaching out to people.
Yes. So that is a really good question. Carrying the label of dismiss definitely impacted my confidence, and I felt like led to me being very like ashamed, embarrassed, depressed. I remember when I got dismissed, like just being in my room, just crying for days, just trying to figure out what was going to be next, asking God, like, what do you want me to learn in this season? Like, what's next for me? And so I feel like the dismiss label is something that carries a lot of shame because I had heard of being dismissed prior to my dismissal, but every time a student would speak of dismissal, it was in a bad sense. It was as if the student had passed away, like, oh, they got dismissed, like they are never coming back. It was just like a bad, a negative, um, what's the word I'm looking for? It was just very negative around the word, and it just made it seem like it was the end of the world, really. If you got dismissed, it's the end of the world. Your world is over. Like there's no coming back from that. And so it definitely impacted my confidence. And I felt like for a while it led to me being depressed. But I always have this thing that like I don't allow certain moments to stay with me forever. It's like I set a timer or I set a time frame and I'm like, hey, I'm gonna allow myself to cry for this amount of time, this amount of days. And then from there I can't cry no more. Like there's no point in crying. Like I have to come up with solutions. Like me sitting in my bed crying is not coming up with solutions. It's not productive. And so I always try to set a time frame for when I'm going to allow myself to feel those moments because it's important for you to feel those moments. Those moments are very, very much so needed and very much so important, especially for your growth. And so I felt like I experienced emotions, I went through the emotions, and then I got back up and I kept going. I feel like this experience relates to kind of my peers and students who are struggling now because now I have put a face to dismiss. Like I am not wearing dismiss as being ashamed. I'm putting it as I'm being vulnerable. I'm sharing my story. You are not alone. Like this is not something that you're going through alone. Like you have someone else that you can talk to. And I feel like that alone is relatable for people who are going through this. And so a lot of people feel very inclined to reach out to me, which I love because during this time I had no one to reach out to. I had known like maybe one other student who got dismissed, but it's like it's the unknown. Like no one talks about it after that. Because it's just like, well, what are you going to do with your life? What are you going to figure out? And so no one really talks about it. And so I feel like I have taken that word dismiss and have turned the weakest point of my life into my strength. And so I feel like owning that word now, just is just it means so much more now. Because I'm owning it. Like no one can walk up to me and be like, "Oh, you were dismissed." Like, no, you can't embarrass me. You can't shame me. I'm owning it. I'm telling my story, and this is who I am, and this is what you got.
Oh man, you said so many powerful things in there. I love that you said you set a timer for this. I'm going to grieve this for this long, and then it's time for me to get up. I heard a quote, a quote by Jesse Jackson said it a long time ago, but the ground is no place for champions. And I just love that. It's like that's been like resonating with me all day because yeah, we fall down, but champions don't stay there. And so I think you just described that perfectly. And I appreciate your vulnerability about that.
Yeah.
All right. So the next question is kind of a little segue from that. You were dismissed by a system that didn't hear you. How does that help you listen better to patients who feel ignored by the healthcare system? So now we're moving from students into how this is affecting you or helping you as a therapist.
I've always felt like my strength has been in my personality and my ability to relate to literally anyone. And through all of my clinicals and through all my work experiences, that has been kind of like the highlight that people have told me. And so I think in order to listen to my patients, I have to be personable. I have to actively be listening, not just listening. I have to make eye contact. I have to hear them. Like I have to hear what they're saying to me so that they can feel understood. The moment where someone feels like they're not being understood, it's because you're looking away, you're distracted, all these things. So it has very much so taught me like there are certain times where, yeah, I need to multitask and I'm on my computer and I'm listening. But there are times where I close my computer and I'm giving you eye contact because the situation calls for that. And I feel like some people don't have that discernment on when to do which is very, very much so important. And I feel like a lot of people gravitate towards me, and a lot of people say like, "Oh my God, you're so amazing. I love working with you. I want to work with," like people literally say that. They're like, I've been looking forward to working with you. You're always smiling. You always have this great personality." And it's just like I've always treated people as though they were my family or they were someone that was coming through the door that I knew. If my family was coming in here, well, how would I want them to be treated? And so I display that to my patients. And I feel like the system that did not hear me, I'm trying to be the change that I did not have. And because there's no point in continuing this bad pattern. Like I have to be the change that I want to see. And so I feel like that allows me to be more personable. And it also allows me to take the time to like really listen when I feel like they need a listening ear. Because 9 times out of 10, people just need to vent. Like sometimes coming across my patients, this is their first time getting out of the house. They don't really talk to people that much. Like they're going through a tough time. No one else can relate. So it's just like sometimes they just need a listening ear. And that listening ear goes a long way. And also, I'm just very passionate about what I do. And people can tell when you're passionate about what you can do versus people who are not. So,
Preach, Dr. Jackson. I love that. I love that. I love that. I love that. Thank you so much for sharing that. I believe that there are so many smart therapists out there that don't have that connection. And so who cares how smart you are
yeah.
if your connections are not solid enough that your patients want to listen to you. You could have the best knowledge in the world, but if you're not relatable and you're not relevant, it does not matter. Thank you.
Hmm.
All right. So this next question is, if grades and board scores aren't the only way to measure a good PT, you kind of talked about this already. What
Hmm.
qualities do you have that the current system is missing? I feel like you just answered that, but let's go ahead and talk a
Yeah.
little bit more about it.
So I feel like the current system is really missing out on kind of what I mentioned, like personality. Like in order to work with people, you have to be personable. So if I'm treating people, and also as physical therapists, we are up close and personal. We are touching people. We are a part of a very vulnerable part of their journey. So you just have to be personable because it's very soft territory that you're entering into. So personable. You also have to be passionate. Like people can tell if you're just showing up for work or are you showing up because you actually love what you do. And people tell me all the time that I move like I love what I do because I do. Like I worked my butt off to be in this position. I'm not going to take it for granted. You also have to be willing to actively listen instead of listening or just instead of just saying you heard them, but actually hearing what they're saying. Because there's a difference between just sitting there and saying, oh, okay, I heard you, and then actually listening. And I think taking that extra time to put down the computer, make eye contact, give them those kind of those, give them that you're interested from your body language. And then I would also say just willingness to also accept when you don't know. I tell patients all the time, I'm like, I am new to this profession as a clinician. If I don't know something, I'm going to tell you I don't know, but I'm also going to look into it and try to figure it out for you. But I'm not going to sit here and pretend like I know all the answers because I don't. And you always have to be willing to be teachable. I read that before and I'm just like, that's a really great quote. Be teachable. Because people who are no longer teachable, they're stuck in their ways, and that is not how I want to be. So I think that those qualities are what is missing in this current system.
Excellent, excellent, excellent. All those things give our patients the autonomy that they need, right? I think that people want to govern their own bodies and their own health, and we should be empowering them to do
Mhm.
that. But instead, many times we're on these egos, right? And we're with it, I'm doctor, I'm the king, right?
Mhm.
And our patients are lost in that shuffle. So I appreciate that answer.
Yeah. And I always try to wrap up anytime I'm working with someone, I always try to wrap up and say, like, I'm so grateful that you worked with me today. Like adding that little bit. Because it's just like at the end of the day, people can choose to work with whoever they want to work with. And I'm just showing that little bit of just gratitude that they are working with me for this day and this time period. So I think that that's also important, showing gratitude.
I like that. I like that. I like that. Okay, we got one more question, and then what I want to do after you answer this is just to just tell the audience kind of what you're into, if you got anything coming up that you want to share, or how we can get access to you and all the great things that you've done. Your book, I don't want to talk about it. You can talk about it. But let me ask this question. So, the last thing that I have on the docket to ask you is, how are you intentionally building a legacy that actively dismantles health inequities?
That's a really great question. And I feel like I have been working on this for quite some time. I feel like when I initially graduated from college, it was me reaching out to students who were interested in pre-physical therapy. Because when I was in undergrad, I was a part of the pre-physical therapy club. And so after graduating and kind of going into observation hours, I felt like intentionally I was like, anytime I saw a student or met a student that was pre-physical therapy, I'm like, come here, come over here, come over to this side. Like, I need to tell you all the things. This is where you need to go. So I feel like being very intentional when I hear that people are interested, because you never know what moment is going to spark their interest or continue to spark their interest. And so being very intentional on mentoring others, when I see that there is definitely a need. In addition to that, I feel like I created my TheraPins business because I saw that there was a lack of just representation within healthcare, specifically physical therapy, on enabled pins. And so the reason that people don't really know about physical therapy is because people don't talk about it as much. People aren't as knowledgeable about it. But if they see it repetitively and they see it on a book bag or they see it on a blazer, like you never know what is going to be that exposure, but at least they can say that they've seen it, you know. You have to go the extra mile in order to understand what it is that we do, because there's just so much that we do within our scope of practice. And so I felt like that is also something that I'm doing to visually put physical therapy on the board. I also have my children's book. And so I thought that there was just a disconnect for children at a younger age, not aspiring to be physical therapists. Because for so long we've been saying there's only 4% of African American physical therapists within our profession. 4% is low. It's super, super low. And so I've just been trying to figure out, okay, like why is it so low? Like what is it? Um, and I think that sometimes the disconnect is that children at a younger age are just not being exposed to it, so they don't know what it is. Some adults to this day still don't know what physical therapy is and still doesn't know what we do. So it's like if I can have that exposure to children younger, that's definitely what I'm going to do. So that was kind of really the purpose of the children's book, is to embrace on representation and showing children, especially children of color, that we belong in healthcare. And so the point of that is to address all allied health professions. But right now, the first book just kind of focuses on emergency medicine. But we plan to do like a whole series on that showcases all allied health professions. So that's exciting. And then lastly, I feel like the dedicated to PT um, like Instagram page and TikTok. I feel like me just being very vulnerable with my story, I feel like that is also helping out with people who are actively interested in it. Because anyone can go on TikTok and find a page. But sometimes sometimes some of my videos get more views than others. And so with that exposure, it just brings more people to your page and more exposure to the profession.
I love it. I love it. I love it. And I can attest to the fact that Bria is mentoring already, because she was just speaking to my little baby who is interested in PT school. And so I just love the fact that you are just we are just watching kind of legacy in motion here. And I just
Mhm.
love that. And I appreciate so much that you are dedicated and that you stayed in this game and that you are here with me. You are a co-colleague and a soror, and you're doing this thing, and I could not be more proud of you.
Yeah.
So you kind of talked about that. So I'm going to put your bio in the link so that people can get
Mhm.
access to you with all of your pages and things of that nature. Is there anything right now that you want my listeners to know about to catch you on or doing something great?
Yeah, so follow me on Instagram and TikTok at the Dedicated PT. You will hear all about kind of like physical therapy things, my journey on there. You can also join my Facebook group called Dismiss to Doctor, that creates a community for students who have gone through academic suspension, probation, dismissal. It is just a space, a safe space for everyone to come in and just ask, where I provide resources, and then people also ask for help. So it's a space for specifically those students. So I definitely want you all to join that. That's also linked in the bio. And then to I'm going to be announcing my podcast soon. So follow my podcast on Instagram at Dismiss to Doctor.
Awesome, awesome, awesome. Thank you so much for spending some time with us. I get to be with her and talk to her a lot, but I thought it was important for you all to hear about her story because again, I think it's so powerful and the vulnerability, the strength that it takes to be vulnerable is what we're lacking right now. Like that leads to integrity. And we are just missing the boat in this country, in this world right now. And we need more people like you who are doing the good and necessary work that you're doing. So thank you for being on the show today.
Thank you so much for having me. This is such an honor and just full circle moment.
All right. Thanks.
As you move forward in this course, remember this. Health disparities are not simply about patients, they're about systems. And as future clinicians, you don't just treat bodies. You practice within structures that either reinforce inequity or interrupt it. Reflect on how this episode connects to student learning outcomes and how that understanding may influence your clinical perspective. This is the Anatomy of Inequity,